Hi, my name is Kathleen, and in this presentation I will be discussing primary bone tumors. Our objectives for today are to identify the four most common types of primary bone cancer, recognize imaging features of these four most common types of primary bone cancer on X-ray, MRI, and nuclear scans and CTs, as well as understand common clinical presentations of primary bone tumors and when imaging is indicated. A little bit of background about multiple myeloma. It's the most common primary bone tumor and makes up 1% of all malignancies. Multiple myeloma is a multifocal proliferation of plasma cells that's based in the bone marrow. Typically presents with bone pain and fatigue. Complications of this malignancy include anemia, pathologic fractures, renal failure, and recurrent infection. A lot of that is due to the marrow being overtaken by malignancy. The distribution you can see on the right is typically found in the axial and proximal appendicular skeleton, most commonly seen in the vertebra, but it can also be seen in the ribs, skull, shoulder girdle, pelvis, and lung bones. Next, we're going to talk about multiple myeloma. Imaging appearances, starting with X-ray. First thing, you'll see numerous lytic circumscribed bone lesions. You can also see endosteal scalloping around those. You'll also see generalized osteopenia sometimes, as well as pathologic fractures if those complications occur. On the X-ray images here, we have a skull and a humerus we're looking at, and you can see the lytic lesions of varying sizes in the skull and the right humerus. Typically, this skull pattern is called a raindrop skull with these punched out latencies. Next, on MRI, you'll typically see hyperintense lesions on a T2 imaging with varying degrees of enhancement. On the MRI image here, you can see this sagittal T2 weighted MRI of the T-spine showing hyperintense lesions in the vertebra, as well as a few pathologic compression fractures. Next, we're going to talk about some background of osteosarcoma. It's the second most common primary bone tumor behind multiple myeloma. Most common primary bone malignancy in childhood, average age being between 10 and 20 years for these patients. However, it does have a bimodal distribution in younger patients and older patients. Its clinical presentation typically presents with bone pain, palpable soft tissue mass, swelling, and occasionally pathologic fracture. The primary type of osteosarcoma is in that younger population. The secondary type is in elderly patients who've had prior radiation therapy, bone infarcts, malignant degeneration of Paget disease, and just older patients in general. You can see the distribution on the picture on the right of this slide. Typically, osteosarcoma is in the distal femur, 40% of osteosarcomas are there, next being the proximal tibia, and the proximal humerus is also being common sites. Starting with X-ray imaging appearance of osteosarcoma, you'll typically see medullary and cortical bone destruction. It's a pretty aggressive tumor. And you can also see a periosteal reaction, such as the Codman triangle and the sunburst pattern. Our top left, you can see on that femur a sunburst pattern where you can see all that white stuff behind the bone posteriorly where soft tissue is supposed to be, but that's a periosteal reaction. In the top right, you can see a Codman triangle where you can kind of just see a triangular piece of bone sticking out in the top right. Next, imaging appearance of MRI. Typically, you can see metaphyseal spread to the epiphysis is really common with this tumor. It's pretty aggressive. And you'll also see hyperintense signal on T2 and enhancement in both the bone and the surrounding soft tissue due to the aggressive nature of this tumor. And you can also see hypointense mineralized components on MRI, and you can see that in the bottom picture where you can see a T1 sequence that's diffuse heterogeneous enhancement. Next, we're going to talk about Ewing sarcoma. It's the second most common primary bone malignancy in childhood. This type of sarcoma arises from the medullary cavity and typically occurs in young patients, similar to osteosarcoma, around 10 to 20-year-olds. Clinical presentation of this is also very similar to osteosarcoma. You can have a bone pain, a palpable mass, but you can also have systemic symptoms in this cancer, including an unexplained fever, and you'll often see an elevated ESR and LDH as well. This image shows the typical sites and distribution of Ewing sarcoma, most commonly in the femur, around 45% of sarcomas, then the pelvis, the upper limb, spine, and ribs are also pretty common sites. Starting with X-ray for the imaging appearance of a Ewing sarcoma, it's a typically ill-defined bone lesion and very permeative. You can also see, similar to osteosarcoma, an aggressive periosteal reaction. Typically, it looks kind of like layered onion skin outside of the bone, as in like extra cortex. And then you can also see a large adjacent soft tissue mass. You can see that really well in this top image here. You can see that large soft tissue mass. On MRI, it's typically a T2 hyperintense signal that's heterogeneous, and you have diffuse enhancement of the involved bone and soft tissue mass, similar to osteosarcoma on T2 as well. So in this top X-ray image, you can see this permeative osseous lesion with the onion skin reaction bilaterally in the adjacent soft tissue mass. In the bottom, you can see a post-contrast T1 weighted MRI sequence showing an enhancing permeative bone lesion with a large adjacent soft tissue mass as well. Finally, we're going to talk about Chondrosarcoma and a little bit of background information about this cancer. This is a malignant cartilaginous tumor, most commonly seen in elderly patients. It makes up 25% of all primary malignant bone tumors. Typically, this presents with pain and a palpable mass as well. And then the distribution you can see in the imaging. It's most commonly seen in the long bones, so those are a bit darker red on the picture. You can see it in the femur and the proximal humerus quite commonly, but you can also see it in the pelvis as well as other sites, including the ribs, spine, scapula, sternum, and then the head and neck as well. Finally, we're going to talk about the imaging appearance of chondrosarcomas, starting with X-ray. These are often lytic lesions, sometimes permeative appearance, similar to a Ewing sarcoma. There's also a soft tissue component with intralesional calcification, sometimes called a ring and arc appearance, and you can see that endosteal scalloping as well that we've seen in other primary bone tumors. This top X-ray image shows an ill-defined lesion with a soft tissue component with a lot of calcification surrounding the bone. Moving on to MRI, you also see a T2 hyperintense component of non-mineralized components, and then hypointensive mineralized components, and you see heterogeneous enhancement of these chondrosarcomas. In this bottom image, you can see marked hyperintensity on this T2 image associated with this chondrosarcoma lesion. And I believe that is everything. Thank you for listening, and hope you learned about primary bone tumors.